Good afternoon, folks. This afternoon's topic is kind of twofold. It's first part of it discusses assisted dying. Second part of it discusses um person-centered person-centered care for patients, okay? For their end of life choices. Okay, so we're going to go through that this afternoon for B. So please join me in today's discussion B. Give me a few minutes to set these notes up for the presentation, please. Okay, folks. Now, like I said, this presentation sort of twofold. First part of it discusses assisted dying, and the second part of it discusses person-centered care for their end of life choices. Okay, so here we go. The article discusses a new international survey published in the Journal of Medical Ethics, which found that more than half of doctors, more than half of doctors would consider assisted dying if they had advanced cancer or Alzheimer's disease. The research suggests that physicians tend to favor symptom relief over life-sustaining treatment for their own end-of-life care. Okay, key points. Doctors' personal end-of-life preferences may influence their clinical decisions regarding patients' treatment. The study updates previous research, which was often outdated or too narrow. The survey included doctors from 8 locations with differing laws on assisted dying, including Belgium, Italy, and Canada, and several US and Australian states. Some regions like Oregon have had physician-assisted dying laws in place since 1997, while others like Wisconsin continue to debate legislation. Would you like a deeper analysis of its implications for healthcare policy or patient autonomy? I know you're interested in person-centered care planning and self-directed services, which tie into these ethical considerations. This survey has significant implications for healthcare policy or practices, particularly in shaping end-of-life care policies and physician decision-making, since more than half of doctors surveyed would consider assisted dying for themselves. Okay, in the case of advanced cancer or Alzheimer's, it suggests that medical professionals may prioritize comfort and symptom relief over life-prolonging interventions. Here's how this might influence healthcare. Shift in patient care discussions. If physicians lean toward symptom relief for themselves, they may be more open to discussing palliative care and assisted dying with their patients. Legislative impact. Regions still debating physician-assisted dying laws like Wisconsin may use these findings to relevate their policies based on physician preferences. Training and ethical considerations. Medical ethics education may need to expand discussions on autonomy and personal bias to ensure doctors provide balanced guidance. Person-centered care. This aligns with approaches like self-directed services, which focus on individual autonomy in healthcare decisions, an area I know you're passionate about. Would you like to explore how this connects to person-centered planning or healthcare systems reforms? Absolutely. Person-centered care is an approach to healthcare that prioritizes the individual's unique needs, preferences, and values rather than applying one size fits all policy, folks. Um, it emphasizes, hold on, I get autonomy, dignity, and collaboration between patients and healthcare providers. Key elements of person-centered care: individualized treatment plans. Healthcare decisions are tailored to the patient's personal goals, lifestyle, and values rather than simply following medical protocols. Shared decision making. Patients are actively involved in choices about their care, ensuring their voices are heard. Holistic approach. Care extends beyond medical needs, incorporating emotional, social, and environmental factors that influence well-being. Self-directed services. In models like agency with choice, individuals have more control over their caregivers' budgets and care plans, aligning with your interest in autonomy-driven healthcare. Okay. Caregiver empowerment. Family members and caregivers are given training, support, and flexibility to reduce burnout and enhance patient care. This approach is particularly relevant to aging populations, dementia care, and chronic disease management, aligning with your focus on caregiving models that prioritize autonomy and dignity. Would you like to explore how person-centered care is being implemented in self-directed Medicaid programs or long-term care facilities? Certainly. Person-centered care offers a range of benefits that enhance both patient outcomes and overall healthcare effectiveness. It shifts the focus from standardized treatments to individualized care, ensuring that each person receives support tailored to their unique needs. Key benefits: improved patient satisfaction. Individuals feel heard and respected, leading to better engagement and cooperation in their treatment. Enhanced autonomy and dignity. Patients have greater control over their healthcare choices, fostering independence, which aligns with models like self-directed Medicaid services. Okay. Better health outcomes, personalized interventions, reduce stress and complications and unnecessary treatments, improving quality of life, reduce caregiver burnout, empowering patients helps balance caregiving responsibilities, minimizing emotional strain, something I know you're deeply invested in. Efficient healthcare resource allocation. By focusing on individual needs, person-centered care helps avoid wasteful interventions, ensuring cost-effective treatments. Then you've got stronger patient-provider relationships. Collaborative decision making builds trust, ensuring more responsive and compassionate care. Okay. Given your interest in autonomy driven caregiving, would you like to explore how person centered models are integrated into long term care settings or dementia interventions? Person centered care has a profound impact on elderly patients, enhancing their autonomy, dignity, and overall well being. This approach tailors healthcare to individual preferences rather than applying a standardized model, which is especially crucial for older adults who may have complex medical and personal needs. Key benefits for elderly patients: improve quality of life by focusing on personal values and preferences. Elderly individuals experience greater satisfaction and emotional well-being. Enhanced autonomy. Seniors are encouraged to actively participate in their care decisions, fostering independence. Better health outcomes. Personalized care reduces stress, unnecessary treatments, and uh, complications, leading to improved physical and mental health. Stronger patient provider relationships. Trust and collaboration between seniors and caregivers strengthen communication and responsiveness. Reduced caregiver burnout. Family members and professional caregivers benefit from structured support systems, making care more sustainable. This approach aligns with your interest in self-directed services and autonomy-driven caregiving. Would you like to explore how person-centered care is integrated into long-term care facilities or dementia interventions? Person-centered care differs significantly from traditional care methods, particularly in how it is prioritized individuals' autonomy, preferences, and holistic well-being over standardized medical routines. Key differences: decision making. Traditional care decisions are often made by healthcare providers with minimal patient input. Person-centered care. Patients actively participate in care planning, folks. Ensuring their values and preferences shape their treatment. Care, care approaches. Traditional care focuses on diagnosis, disabilities, and standardized treatments. Person-centered care emphasizes individual strengths, preferences, and life experiences, tailoring care to personal needs. Okay, daily routines, traditional care. Schedules are rigid, based on facility convenience. Person-centered care. Routines are flexible, adapting to the patient's lifestyle. Social and emotional well-being. Traditional care primarily addresses physical health, often overlooking emotional and social needs. Person-centered care integrates mental, emotional, and social factors, fostering community and belonging. Caregiver interactions. Traditional care. Staff rotates. Assigns leading. Staff rotates. Assignments leading to impersonal interactions. Person-centered care. Caregivers build long-term relationships, enhancing trust and personalized support. This approach aligns with your interest in self-directed care, self self-directed services, and autonomy. Driven caregiving. Would you like to explore how person-centered care is being implemented in long-term care facilities or dementia interventions? Okay, guys, I'll be back on shortly with some more shows for you. Give me a little bit to take a break first. I'll be back on in a little bit. For now, Gator Wellness, take care, folks.